Ever walked into a hospital and felt like, bam, hit by this wave of controlled chaos? Doctors, nurses, patients rushing around, beeping machines, that antiseptic smell.
It's a lot to take in.
It is. But there's this whole other side most people don't even see, like who's making sure it all runs smoothly. That's what we're diving into today, the hidden world of hospital management.
Should be interesting.
Big shout out to London Heartbeats D Academy, by the way, for giving us some awesome material to work with. Okay, so our main source is hospital management. And get this, the field has totally transformed. We're not talking senior doctors just kind of falling into management roles anymore.
Nope, not anymore.
That's a whole profession now, right?
Exactly. Modern hospitals are so complex. Think about it. Heart transplants, super specialized cancer treatments, those tiny babies in the NICU.
Yeah, wow.
It's a whole different ballgame from those early hospitals, just basic care. You need real expertise to manage all that.
Makes you think, right? Does all that management stuff affect the care we get?
Great question. And we'll definitely dig into that. But first, think about how things used to be, like the old days. Just senior doctors kind of making it up as they went along.
Just winging it.
Pretty much. Couldn't keep up with how healthcare was changing.
So that's why we have these special programs now, right? For hospital administration.
Exactly. Bachelor's and master's programs, the BHA and MHA, they cover everything from healthcare law to finance, ethics, even strategic planning.
Wow. So it's not just about balancing the budget, it's about this whole ecosystem.
Absolutely. And they teach you how to be a manager, too, not just the technical stuff, like leadership, communication, problem solving.
And people skills.
Right, because hospital managers need to be adaptable, decisive, able to inspire their team, especially when things get tough.
Now, the book talks about this thing called the Hospital Management System, or HMS.
Yeah, the HMS.
Sounds super techy. What is that, like a computer program?
It's more like the brain of a modern hospital. It's a network of software modules managing every single thing.
Everything.
Well, pretty much. Patient records, billing, ordering supplies. The book uses Medinus HMS as an example.
Okay. So what are the advantages of having this system? Like, what's the point?
Well, first off, better care for patients.
How so?
Because everything's connected. Doctors can see patient info instantly, so they make better decisions, fewer mistakes.
Oh, that makes sense.
And it makes everything more efficient, too.
Uh-huh.
Processes are streamlined, information's readily available.
And I bet it helps save money.
Absolutely. Less waste, smarter resource allocation, and more accurate billing. So you can reinvest those savings back into patient care.
Win-win.
Yeah.
So this Mednia's system, the book actually lists all the different modules it has.
It does.
Want to give us the highlights?
Sure. So first, you have the help desk module.
Yeah.
Think of it like customer service for the hospital.
Makes sense.
Then there's registration, where they collect all the patient info.
Like name, insurance, all that.
Exactly. Creating a record for each patient.
Okay. And then the big one, right? The electronic medical record, the EMR.
This is where it gets really cool. It's the digital version of the patient's entire medical chart. Everything's in there. History, test results, medications, allergies, the whole shebang.
So no more digging through paper files.
Not with an EMR. Everyone can see everything instantly, which makes a huge difference. Fewer mistakes, better coordination. It's a game changer.
Wow. So what else?
Well, there are modules for billing, obviously. You got to manage all those insurance claims and payments.
Yeah, that sounds like a headache.
And then financial accounting keeps track of, well, the hospital's money, making sure they stay afloat.
Keeps the lights on, huh?
Exactly. Then you have fixed assets. That's for stuff like equipment and buildings, making sure everything's maintained. And payroll, because everyone needs to get paid.
It's like this system handles every little detail.
It does. And then there are modules for specific areas of patient care.
Okay, like what?
Well, outpatient management handles all the patients who don't stay overnight.
Like clinic visits and stuff.
Yep. Then inpatient management takes care of the ones who are admitted, managing beds, meds, discharge plans. It's a whole orchestration.
And what about all the different departments?
They have modules, too. Pharmacy for managing medications, general store and inventory for all the other supplies.
Like bandages and staplers.
Exactly. Everything they need to keep running. Then you have the diagnostic departments like laboratory for blood tests and all that.
Oh, and radiology for all the scans, right?
Yep. X-rays, CT scans, MRIs, the whole shebang.
So cool. And are there other modules too?
Oh, plenty. Nuclear medicine, physiotherapy, dental.
Sounds like every specialty has its own little section.
Pretty much. And finally, there's a services module. That's for things like ambulance transport, food service, social work, all those extra things that help patients.
Wow, this HMS is seriously impressive. It's like a well-oiled machine.
Yeah.
But beyond these modules, are there any other cool features that make it stand out?
Definitely. One thing that caught my eye is that doctors can see investigation reports online.
So, like blood test results.
Yep, instantly. No more waiting for paper copies. It speeds things up and reduces errors.
That's so much better.
And speaking of efficiency, doctors can also view their appointments online, which helps them stay organized and on top of their busy schedules. No more double booking.
Makes sense. What else?
This one's a biggie. Electronic signatures on prescriptions.
Oh, so no more trying to decipher doctor's handwriting.
Exactly. It's more secure, too, because there's less chance of someone forging or changing a prescription.
That's a relief.
Yeah.
Okay, but with all this digital info flying around, what about keeping things private? Like patient records?
That's a big concern. The book emphasizes that hospitals have to take security super seriously.
I'd hope so.
The Middleness system, for example, has lots of layers of protection, like access controls, so only certain people can see certain info.
Right, like a nurse wouldn't be able to see financial records or something.
Exactly. And encryption, which scrambles the data so it's unreadable without the key. Plus, they do regular audits to make sure everything's working right.
Wow. So it's not just about keeping hackers out. It's also about making sure the right people see the right information.
Absolutely. And that brings us to another important issue. The legal and ethical challenges that come with having all this healthcare info online. It's a whole can of worms.
Okay, let's open that can then.
Yeah.
What are some of the things hospitals have to be careful about?
Well, privacy's a big one, right? Making sure patient info stays confidential. With everything digital, it's easier than ever for info to get shared accidentally or even stolen.
It's kind of scary to think about.
It is. Hospitals have to be extra careful to protect that data. And then there's the issue of data integrity, making sure the information is accurate. Unlike with paper records, someone could change something in a digital file and you might never know.
So how do they make sure the info is correct?
Well, they need systems to double-check everything to make sure it hasn't been tampered with, and clear procedures for correcting mistakes. And then there's the whole question of electronic signatures.
Like for prescriptions we were talking about.
Yeah. Hospitals have to make sure those are legally sound, secure, and that they can't be forged.
So it's not just about the tech itself. It's all the legal stuff that goes along with it.
Exactly. And another legal thing to keep in mind is product liability.
Product liability.
Like, if a medical device malfunctions and hurts someone, the hospital could be held responsible.
Even if it wasn't their fault.
Well, they still have a responsibility to make sure that devices they use are safe, to do their homework and have procedures for checking and maintaining them. And that's especially important because, well, the goes into this case study about essential elements for post-abortion care, and
It's a pretty sensitive topic.
it is, but it shows how important it is to manage these situations carefully, ethically, and with the patient's well-being in mind.
So what's the main takeaway?
Well, the book starts by saying that unsafe abortion is a huge problem worldwide, especially in places where safe, legal abortion isn't available. It can lead to serious complications, even death.
That's awful.
It is, and the book stresses that it's not just about treating the medical problems after the fact. It's about addressing the bigger picture. Why are women having unsafe abortions?
Lack of access to contraception, maybe.
Yeah, that's part of it. But also education, counseling, helping women understand their options and feel empowered to make choices about their bodies.
It's a complex issue.
It is, but it needs a comprehensive approach, one that respects women's rights and autonomy.
I agree. So how does this relate to hospital management?
Well, the book talks about this model called the Essential Elements of Post-Abortion Care, or PAC.
PAC pay. Okay. What's that about?
It's a guide for healthcare providers to make sure they're offering truly comprehensive care.
So what are the essential elements?
Well, first, it's about community and service provider partnerships. That means working with the community, not just swooping in with solutions that might not fit.
Makes sense.
Then there's counseling, because this experience can be really tough emotionally. And then, obviously, treatment, making sure any complications are addressed quickly and safely. And then family planning and contraceptive services, because...
So it doesn't happen again.
Right. Helping women plan their families and control their reproductive lives. And finally, reproductive and other health services. This covers a whole range of things like STI testing, support for survivors of sexual violence, even infertility treatment.
Wow. It's about so much more than just the immediate medical issue.
Exactly. It's recognizing that reproductive health is part of overall well-being, and women deserve comprehensive support.
It's a really powerful example of how good hospital management can make a difference.
It is. It's not just about numbers and budgets. It's about people's lives.
Absolutely.
Mm.
Okay, so towards the end of this section, the book shifts gears a bit. It starts talking about how a hospital structure impacts its management.
Ah, yes. The chapter on functional hospital organization.
And it sounds like there's some debate about how to organize things best.
There is. You have the traditional way with departments based on function, like cardiology, radiology, surgery.
Right, all in their own little silos.
Exactly. But there's a movement toward a more process-oriented structure. So instead of focusing on departments, you focus on the patient's journey. Like, okay, this person needs heart surgery, so how do we get them from point A to point B most effectively? Involves lots of different departments working together.
That sounds a lot more efficient and less confusing for the patient.
It is. The book talks about the concept of the patient-focused hospital, where the goal is to make the whole experience as smooth and seamless as possible. And they use tools like care programs and clinical pathways.
What are those?
Think of them like roadmaps for coordinating care. They outline the steps involved so everyone's on the same page and the patient gets the right treatment at the right time.
That's smart. So like if you need a hip replacement, there's a preset plan.
Kind of. It helps to standardize things and reduce errors. Of course, the book acknowledges that changing a hospital structure isn't easy. You need buy-in from everyone.
I can imagine. Doctors, nurses, administrators, everyone's used to doing things their way.
Exactly. But when it works, it really works. The benefits are huge, not just for patients, but for staff satisfaction, too. It creates a more collaborative environment.
So it's a cultural shift, too, not just a structural one.
Absolutely. And the book even talks about how to measure a hospital's process orientation.
Really? How do you do that?
Well, there's this tool called the Hospital Process Orientation Tool, or HPO.
What does it look for?
It assesses things like how well departments collaborate, whether they're focusing on improving processes. It helps hospitals figure out how well they're adapting to this new way of working.
That's really interesting.
It is, and it shows how seriously hospitals are taking this shift towards a more patient-centered approach.
That's really encouraging. Well, this has been a fascinating dive into the world of hospital management. I'm learning so much.
Me too. It's amazing how much goes on behind the scenes to make sure hospitals run smoothly.
And it all starts with the management. A huge thank you to London Heartbeat Z Academy for giving us this incredible material to explore.
Yes, thank you, London Heartbeat Z Academy.
For everyone listening, be sure to check them out on Facebook, Instagram, Spotify, and YouTube. They have tons of great content about healthcare.
They do. And stay tuned for part 2 of this deep dive, where we'll explore even more about the world of hospital management. So we've talked about the systems and structures in hospitals, but what about the people running the show, the actual hospital managers? What do they need to know to do the job well?
Right. What does it take to be a hospital manager?
Well, obviously you need good management skills, planning, budgeting, HR, all that stuff.
The basics.
But healthcare is a whole different animal. It's not like running any other business.
So an MBA from, like, Harvard wouldn't be enough?
It'd help, sure. But you really need specialized education for this field.
Like what?
Master's degrees in health services administration, long-term care administration, even public health or public administration can be useful. And there are MBAs with a focus on healthcare. It's all about understanding the ins and outs of the system, the laws, the ethics.
The whole 9 yards.
Right. And they teach you the practical stuff too, like quality improvement, patient safety, data analysis.
Sounds intense.
It is, but it prepares you for the real world of managing a hospital.
So you need a master's degree.
Well, for some entry-level jobs, a bachelor's might be enough,
Oh,
especially in smaller places or specialized areas like medical records, health information management.
I see.
And sometimes experience can trump a degree. If you've worked in healthcare for a long time, that counts for something.
So there are different ways to get your foot in the door. What about if you want to move up the ladder? Become a big-shot hospital administrator?
There are residencies and fellowships, just like for doctors.
Really?
Yeah. You work alongside experienced professionals, get hands-on training.
Learn the ropes.
Exactly. It's a great way to build your skills and make connections. But degrees and training aside, there are some qualities that make a truly great hospital manager.
Like what? What are we looking for here?
Number 1, people skills. Hospital managers deal with everyone. Doctors, nurses, patients, families, board members.
That's a lot of personalities.
It is. You got to be able to communicate clearly, listen, build consensus, a little bit of a diplomat.
And I bet you need to be quick on your feet, too. Things change fast in a hospital.
All the time. You need to stay calm, make decisions under pressure, adapt to new situations,
So it's a mix of, like, strategic thinking and being good with people.
and being a strong leader. You got to inspire your staff, keep them motivated, especially when things get tough.
It's a pretty big job.
It is. But it's also incredibly rewarding, knowing that you're playing a part in helping people heal, making a difference in their lives.
That's got to feel good.
It does. Okay, so let's dive into the specifics. What do hospital managers actually do? Well, the book lists a ton of responsibilities.
Lay it on me.
Well, you've got the big picture stuff, like developing the hospital's strategic plan, setting goals, monitoring progress, figuring out where things are going.
Sounds like a lot of planning ahead.
It is. You got to analyze data, spot trends, anticipate problems, and then make decisions that affect the entire hospital.
So it's more than just keeping things running day to day.
Right. It's about steering the ship, making sure it's heading in the right direction. But of course, you also have to manage the day-to-day operations, overseeing budgets, making sure resources are used wisely, managing staff, hiring and training new people.
And all that paperwork, right, all the regulations.
Oh, yeah, lots of paperwork. But all of this, ultimately, is to ensure one thing: quality patient care. Hospital managers are responsible for setting those standards, monitoring outcomes, making sure patients are satisfied.
It's a big responsibility.
It is. But like I said, it's incredibly rewarding. Knowing you're part of something that helps people makes their lives better.
Makes it all worthwhile.
Exactly. And it's not a solo job either. Hospital managers have to be great communicators, collaborators. They're always working with other people.
Meetings, meetings, meetings.
You got it. Meeting with department heads, talking to doctors, listening to patient concerns, dealing with insurance companies.
Sounds exhausting.
It can be. But communication is key. It's how you build trust, resolve conflicts, make sure everyone's working together.
That makes sense. Okay, so we talked about the HMS before, that hospital management system.
The brain of the hospital.
Right. But how does it actually work in practice?
Well, it's basically a bunch of software programs working together. Remember the book uses that Metternich system as an example?
Yeah, I remember.
It's a good illustration of how these systems manage everything. Patient registration, billing, pharmacy inventory, all of it.
What are the biggest benefits of using an HMS?
Well, efficiency is a huge one. By automating tasks and streamlining processes, it frees up staff to focus on more important things, like, actually caring for patients.
The technology helps them do their jobs better.
Exactly. And it reduces errors. Think about things like medication dosages, billing codes. With a computer doing the heavy lifting, there's less chance of a human slip-up.
That's going to be a huge relief for everyone.
It is. Another big benefit is better coordination of care. With all the patient info in one system, everyone's on the same page. Doctors, nurses, pharmacists, they can all see the same records, the same test results.
No more miscommunication.
Less, for sure, which leads to better decisions and better outcomes for patients. And then, of course, there's the potential for cost savings.
Gotta love saving money.
Right. Streamlining processes, using resources more efficiently. That all adds up. And it frees up more money to invest in things like new equipment, better facilities, research.
So it's a win-win for everyone. Now, the book goes into detail about each module in the Metternich system.
It does. Want to take a tour?
Lead the way.
Okay, so first up, the help desk module. This is where patients go with questions, concerns, or if they need help navigating the hospital.
Kind of like the front desk.
Sort of, but more focused on providing information and assistance. It's important to make a good first impression and make patients feel welcome.
Makes sense. What about registration?
That's where they collect all the basic info about the patient. Name, address, insurance, medical history, all that good stuff.
Creating their file, basically.
Exactly. And this info is crucial for scheduling appointments, coordinating care, and making sure everything runs smoothly. Then we come to the big one, the electronic medical record, or EMR.
This is like the digital heart of the system, right?
It is. It's the patient's entire medical history, all in one place. Diagnoses, treatments, medications, test results, notes from doctors and nurses, everything.
I can only imagine how much easier that makes things.
It's night and day compared to the old paper charts. It improves communication, reduces errors, and helps everyone provide more coordinated care.
Okay, so what about the money stuff? The book mentions modules for billing and financial accounting.
Right. Got to keep the lights on. Billing handles all the insurance claims and patient payments. It's a complex world, but the module helps to automate and streamline things, making it more accurate and efficient.
And financial accounting is like the overall budget, right?
Exactly. Tracking expenses, revenue, making sure the hospital is financially healthy. It gives administrators the information they need to make smart decisions.
I bet that module sees a lot of action.
It does.
Huh.
Then you have fixed assets, which manages all the physical stuff, buildings, equipment, furniture, making sure everything's maintained and running smoothly. And of course, payroll, because everyone needs to get paid.
Can't forget about that.
No, sir. That module handles all the salaries, taxes, deductions, make sure everyone gets their paycheck on time. Okay, now let's talk about the modules that focus on specific areas of patient care, starting with outpatient management.
What's that all about?
This module manages all those patients who don't stay overnight. People who come in for a clinic visit, a test, a procedure.
In and out, same day.
Exactly. The goal is to make the whole experience as smooth and efficient as possible.
Less waiting around.
Less waiting, less stress, more time focused on actually getting the care they need. And then you have inpatient management for patients who do need to be admitted.
Okay, so that's managing the beds, the medications, all that.
Yep. Making sure patients are comfortable, getting the right treatments, and that their discharge goes smoothly. It's a whole coordinated effort.
Sounds like a lot of moving parts.
It is. But that's what hospital management is all about, coordinating all these different pieces to make sure patients get the best possible care.
So what about all the different departments in the hospital? Do they have their own modules in the HMS?
They do, starting with pharmacy. That module manages all the medications, the inventory, dispensing prescriptions.
Making sure people get the right pills.
Exactly. And making sure it's all done safely and accurately. Then you have general store and inventory, which handles all the other supplies the hospital needs, bandages, syringes, cleaning products.
Keeping everything stocked.
Yep. Then there are the big diagnostic departments like laboratory and radiology.
For all the tests and scans.
You got it. The laboratory module manages all those blood tests, biopsies, cultures, and radiology handles x-rays, CT scans, MRIs, all that good stuff.
Pretty high tech.
Oh, yeah. And then there are modules for other specialties, too. Nuclear medicine, physiotherapy, dental.
It's amazing how specialized it gets.
It is. And then there's a module for services, which covers all those extra things that hospitals offer.
Like what?
Ambulance transport, food service, social work, chaplaincy, all sorts of things that support patients and make their hospital stay a little easier.
It's like a one-stop shop for everything you could possibly need.
Pretty much. Okay, so beyond those core modules, are there any other features that make this HMS stand out?
I'm all ears.
Well, one of the coolest things is that doctors can access investigation reports online.
So like if they order a blood test, they can see the results immediately.
Exactly. No more waiting for paper copies or trying to track down results. It's all right there at their fingertips.
That must be so much faster.
It is. It speeds up treatment decisions, reduces errors, and improves communication between doctors.
Makes sense. What else?
Well, doctors can also view their appointment schedules online.
So they can stay organized and avoid double booking.
Precisely. No more missed appointments or scrambling to reschedule.
That's great for everyone. Anything else?
Oh, this one's a big one. Electronic signatures for prescriptions.
So no more trying to decipher your doctor's handwriting.
Exactly. It's more secure, more efficient, and reduces the risk of errors or forgery.
I love it. Okay, but with all this digital information floating around, how do hospitals keep it secure? Like, what about patient privacy?
That's a great question. And the book stresses that security is absolutely crucial. The Medina system, for example, has tons of safeguards.
Like what?
Well, access controls are a big one. Only authorized personnel can access certain information, and it's all based on their role in the hospital.
So receptionists wouldn't be able to see a patient's medical records.
Nope. And all the data is encrypted, which basically scrambles it so it's unreadable without the right key. Plus, they do regular audits to make sure everything's working properly and no one's snooping where they shouldn't be.
That's reassuring.
It has to be. Data breaches in healthcare are a nightmare. Hospitals have to be extra vigilant.
Makes sense. Okay, so beyond just keeping the data safe, what are some of the legal and ethical issues that come with having all this healthcare information online?
That's a really interesting area, and it's one that's constantly evolving. One of the biggest challenges is ensuring patient privacy. With everything digital, it's easier than ever for information to be shared accidentally or even stolen.
That's a scary thought.
It is. Hospitals have to be incredibly careful about how they handle patient data. And then there's the issue of data integrity, making sure the information is accurate and hasn't been tampered with.
So how do they do that?
They need systems to verify the information and clear procedures for making corrections if something is wrong. And then there's the whole question of electronic signatures.
Like for prescriptions.
Exactly. Hospitals have to make sure those electronic signatures are legally valid, secure, and can't be forged.
So it's not just about the technology itself. It's about all the rules and regulations that go along with it.
Exactly. And another legal thing to keep in mind is product liability.
Product liability.
Like, if a medical device malfunctions and hurts someone, the hospital could be held responsible.
Even if it wasn't their fault.
Well, they still have a responsibility to make sure the devices they use are safe, to do their research, and have procedures for checking and maintaining those devices. And speaking of sensitive situations, the book dives into this case study about essential elements for post-abortion care. And
It's a topic that often sparks a lot of debate.
it does, but it's important to approach it from a public health perspective, focusing on the needs and rights of the patients.
Absolutely. So what does the book say about it?
Well, it starts by acknowledging that unsafe abortion is a major global health issue, especially in countries where safe and legal abortion isn't readily available. And it can have devastating consequences.
Complications, infections, even death.
Exactly. And the book emphasizes that it's not enough to just treat those medical problems after the fact. You have to address the root causes.
Like lack of access to contraception.
That's a big part of it. But it's also about education, counseling, empowering women to make informed choices about their bodies and their reproductive health.
It's a complex issue for sure.
It is, and it requires a holistic approach that respects women's rights and autonomy.
So how does this tie back into hospital management?
Well, the book talks about this model called the Essential Elements of Post-Abortion Care, or POCSI. It's a guide for healthcare providers to ensure they're providing truly comprehensive care.
Okay, what are those essential elements?
Well, first off, community and service provider partnerships. That means working with the community to understand their needs and develop culturally sensitive solutions.
Not just imposing your own ideas.
Right. Then there's counseling, because this can be a very emotionally challenging experience.
Of course.
And then there's the treatment itself, making sure any complications are addressed safely and effectively.
And hopefully preventing future complications.
Exactly. That's where family planning and contraceptive services comes in, helping women plan their families and control their reproductive lives.
Giving them the tools and information they need.
Precisely. And finally, reproductive and other health services, which covers a whole range of things like testing for STIs, support for survivors of sexual violence, even infertility treatment.
It's about seeing the whole picture, not just the immediate medical issue.
Exactly. It's recognizing that reproductive health is a crucial part of overall well-being.
This case study is a great example of how hospital management can go beyond just the clinical aspects of care.
It is. It shows how important it is to consider the social, cultural, and emotional factors that affect people's health.
Okay, shifting gears a bit. The book then goes on to talk about how a hospital structure can actually impact its management.
Ah, yes, the chapter on functional hospital organization.
And it sounds like there's some debate about the best way to organize things.
There is. You have the traditional model, where departments are based on their function, cardiology, radiology, surgery, all in their own little silos.
Each doing their own thing.
Right. But there's a movement toward a more process-oriented structure. So instead of focusing on departments, you focus on the patient's journey. Like, okay, this person needs heart surgery. How do we get them from point A to point B most effectively? It involves a lot of different departments working together.
That sounds much more efficient and less confusing for the patient.
It is. The book talks about this concept of the patient-focused hospital, where the goal is to make the whole experience as smooth and seamless as possible.
I like that.
And to do that, they use tools like care programs and clinical pathways.
Does sound familiar. Remind me what those are again.
Think of them like roadmaps for coordinating care. They outline the steps involved in treating a particular condition, so everyone's on the same page and the patient gets the right care at the right time.
So it's kind of like a standardized plan.
Exactly. It helps to reduce errors, variations in treatment, and make sure everyone's following best practices. Of course, the book acknowledges that changing a hospital structure isn't easy. It requires buy-in from everyone, from the doctors to the nurses to the administrators.
I can imagine it's a big change for everyone.
It is. But when it works, it really works. The benefits are huge, not just for patients, but for staff morale and job satisfaction, too.
So it's not just about changing the structure, it's about changing the whole culture of the hospital.
Absolutely. And the book even talks about how to measure a hospital's process orientation.
Wait, you can measure that?
You can. They have this tool called the Hospital Process Orientation Tool, or HPO. It looks at things like how well departments collaborate, whether they're focusing on improving processes. It helps hospitals figure out how well they're adapting to this new way of working.
That's pretty cool.
It is. It shows that hospitals are really taking this shift seriously and that they're committed to finding ways to make things better for everyone.
Well, this has been incredibly insightful. I'm really starting to understand the complexities of hospital management.
Me too. It's a fascinating world and one that most people never really think about, but it plays a vital role in all of our lives.
Huge thank you to London Heartbeat C Academy for giving us all this incredible material to work with.
Absolutely. They're a fantastic resource for anyone interested in the world of healthcare.
Be sure to check them out on Facebook, Instagram, Spotify, and YouTube. You won't regret it. And for everyone listening, stay tuned for part 3 of our deep dive, where we'll explore even more about the challenges and opportunities facing hospital management in the future.
So we've talked a lot about how hospitals work now. But what about the future? What trends and challenges are on the horizon for hospital management?
That's a great question. It seems like healthcare is always changing.
It is. And one of the biggest things we're seeing is the rise of technology, not just inside the hospital, but in how patients interact with the whole healthcare system.
So, like telehealth, virtual doctor visits.
Exactly. And remote monitoring, using wearable devices to track patients' health. All these tools have the potential to make healthcare more accessible, more convenient, maybe even cheaper.
Sounds promising. But I bet it creates challenges for hospital managers, too.
Oh, for sure.
Mm-hmm.
Integrating these new technologies into existing systems is a big one, making sure the staff knows how to use them properly, and of course, keeping patient data secure.
Yeah, that's got to be a constant concern. What other trends are shaping the future of hospital management?
Another big one is the shift towards value-based care.
I've heard that term, but I'm not really sure what it means.
Basically, it's about moving away from that old fee-for-service model, where hospitals get paid for every test, every procedure.
Right, more services equals more money.
Exactly. But value-based care is about rewarding hospitals for keeping patients healthy, focusing on outcomes, not just services.
So preventing illness instead of just treating it.
Exactly. It's a huge shift in how we think about healthcare. And for hospital managers, it means figuring out new ways to track outcomes, coordinate care between different providers, and get patients more involved in managing their own health.
It sounds complicated.
It is, but it has the potential to make healthcare a lot more effective and maybe even more affordable in the long run.
I hope so. Okay, so we've talked about the trends. What about the challenges? What are some of the biggest hurdles facing hospital managers today?
Well, one that's been in the news a lot is the shortage of healthcare workers.
The nursing shortage, right.
That's a big part of it. But it's not just nurses. Hospitals are struggling to find qualified doctors, technicians, even support staff.
Why is that?
It's a combination of factors. The population is aging, so there's more demand for healthcare. And healthcare is getting more complex, so you need more specialized skills. Plus, burnout is a huge issue in healthcare.
Yeah, I can imagine. It's a high-stress job. So what can hospital managers do about this shortage?
Well, they have to get creative. Think outside the box when it comes to recruiting. Offer competitive salaries and benefits, create a positive work environment, invest in training and professional development.
Make it a place where people want to work.
Exactly. And then there's the ever-present challenge of rising healthcare costs.
It feels like healthcare gets more expensive every year.
It does, and finding ways to control costs without sacrificing quality is a constant balancing act for hospital managers.
So they're always trying to do more with less.
Pretty much. It takes a lot of careful planning, strategic thinking, and finding ways to be more efficient.
It sounds like a really demanding job.
It is, but it's also incredibly rewarding. Knowing that you're playing a role in making sure people have access to the best possible healthcare.
That's got to be a good feeling.
It is. And it's a career path that's full of challenges, but also full of opportunities to make a real difference.
Well, this has been an amazing deep dive. I've learned so much about a world I never really thought about before.
Me too. It's been fascinating. And I think it's so important for people to understand what goes on behind the scenes in hospitals. It's a complex system, but ultimately it's all about people.
Absolutely. A huge thank you again to London Heartbeat's Z Academy for providing the material for this deep dive.
Yes, thank you.
Be sure to check them out on Facebook, Instagram, Spotify, and YouTube for more insightful content. And for everyone listening, thanks for joining us on this journey. Until next time, stay curious, stay informed, and most importantly, stay healthy.